Hi, I want to welcome you to my Strategies for Healthy Living workshop. We're doing this every Monday at 12:30 p.m. This is the best place for you to get questions answered regarding chiropractic and how we do things here at our clinic here in Fort Worth. My name is Dr. Payne. I am the owner and the chiropractor for Salence Chiropractic Clinic. So today I am very excited because I get to do secret number 2 to the importance of joint health. And we are tying the importance of joint health with your immune system. So you're probably thinking, wow, that's a jump, but you'd be surprised how everything is connected. So what I'm going to do is I'm going to share my screen with you. Okay, and we're going to start this presentation because I do have some pictures here for you. So you can have visuals to go with everything. So last week we talked about secret number 1, and secret number 1 was to maintain the intricate joint structure and function in order for you to first of all know how important it is for you to take care of your joint health. So the more you understand the anatomy and all the parts that come together to make up a joint, then you can better understand why it is important, number 1, and number 2, you can also understand all the parts that have to be nurtured and taken care of in order for your joints to function properly. So I'm going to do some summary real quick on what we talked about last week, some of the important points. And then I'm going to proceed to secret number 2, where we will talk about the connection between joint health and the immune system. So let's talk a little bit about last week, okay? We're going to do that. Then I'm going to talk to you about the impact of dysfunctional joints, basically joints that aren't functioning properly, and its effect on your nervous system and its effect, therefore, on your immune system. Then we're going to talk about how this affects your lymphatic system, which will also affect your immune system. Okay, so this is an introduction to all of this. We can go into so much detail with all of it, but I'm going to do the highlights for you so you can see how important it is to take care of every joint in your body. So last week we talked mainly about what's called synovial joints. And let's see, make sure nobody has questions. We talked about synovial joints, and we talked about how joints are classified according to their structure and also how they function. So it's not just a joint, it also has a lot to do with structure and function. We also talked about the components of the most common joint in the body is your synovial joint. So if you think of a joint with fluid in it, with cushion in it, right, a disc, and we think about all that providing good shock absorption, then we normally think of that as being a joint. So there are many types of joints, but that is the most common. There are certain things that help to keep the nurture of and nutrition in the joint. And exercise is one of them. Movement is one of them. Every time you move, those synovial joints secrete more synovial fluid, and that will help also not only provide a cushion in your joints, but it also provides nutrition for that cartilage that does not have any blood supply to it. So it keeps the cartilage very healthy. The other thing that we talked about last week was Hilton's Law. And just to summarize it, it pretty much meant that the nerve that supplies the joint also supplies the muscles and surrounding tissues of that joint. So if that joint is not functioning properly, you best believe that everything associated with that joint will not be functioning accordingly as well. So those two have to, and they always go together. So it's not, I'm out of alignment, but my muscles feel fine. No, muscles and joints, they have to go together. So you can't have a muscle spasm without a joint being involved, okay? So that was Hilton's Law. Now, this week, we're going to talk about, okay, so what's the big deal with joints not functioning properly? We know that if they don't, it's going to hurt. okay? And the reason it hurts is because there's an increase in inflammation. As a result, you'll have decreased range of motion, you'll have stiffness. Those soft tissue structures that are around the joint are going to be shortened. So that's also going to contribute to the stiffness of that joint. If a joint isn't functioning properly, it's not going through its full movement, you're also going to see some decrease in production of that synovial fluid that we talked about last week. And make sure no one has questions. And we're going to talk about, and what also happens is that you have decreased nutrition to the cartilage. Another thing that happens is because the muscles around that joint are being compromised, the strength of that joint is now compromised. So now that joint is vulnerable to injury, okay? Other thing that happens is you have little micro injuries that's occurring to that joint when it's not functioning properly. So when you're out of alignment, all of that is happening. There's a whole lot more, but those are the main things that are happening. So when I say micro injuries, I mean like little tears in the cartilage or itty bitty tears in the tendons, or the ligaments are being overstretched or shifted in a certain way where they shouldn't be. All those are little injuries that over time becomes a huge problem. And then one day, boom, you have this symptom that seemed to have come out of nowhere. Okay, so that's what happens with joint dysfunction. But here's the deal. When you have a joint, for example, that is not moving properly, it's gonna affect everything above and below. It's a cascade effect that travels up and down your body. So you might have a left pelvic low back issue, and you notice your right shoulder is hurting. But the way the chains of your body flows from your feet to your head, it's possible that something all the way in your foot can cause issues all the way to the top of your head, okay? So that's one thing. But today we're gonna talk about how it affects your nervous system, why it's so important for you to get adjusted, okay? When your joints aren't functioning properly, your body perceives that as a physical stress. Now, one thing that I guess you could say preach when it comes to subluxations and having misalignments and joint dysfunction, when there is physical, chemical, and emotional stress greater than your body's ability to adapt, that's when you start getting these misalignments and subluxations in your nervous system. But when a joint's not functioning properly, your body sees that as a physical stress, okay? When that happens, you can see here on the screen, cortisol is going to increase. And when cortisol increases, cortisol is one of the stress hormones, okay? It's closely tied to the immune system as well. When cortisol increases, your pituitary gland in your brain, which is one of the master glands in your body, it's going to send signals to all the other glands in the body. So the pituitary gland is like the general, okay? And then all the other glands are the soldiers. So when the pituitary detects an increase in cortisol levels, it's going to start sending signals out, letting all the other glands know what they should be doing. Those signals are hormones, and those hormones affect everything in your body. It's one of the ways your body communicates from cell to cell, okay? Now, as your pituitary gland adjusts to this physical stress of not being able to move, now you're going to get chemical changes in the tissues of the body. This is where it starts affecting the systems of your body. And what we're talking about today is affecting your nervous system and affecting your lymphatic system, which ultimately will affect your immune system. So what I want you to get is how it's a domino effect, okay? If you've ever had a joint in pain, it's stressful. It is stressful because you can't move, you can't use it. So because it's stress, this cascade effect starts to happen in your body, okay? Now, we're gonna see on this slide. This is the first thing that happens when you have these stress hormones floating in your body. you're going to have what's called an upregulation of the autonomic nervous system of your body. So let's talk about the autonomic nervous system. The autonomic nervous system is the automatic part of your nervous system. It's the part where you don't have to tell it what to do. It automatically happens. But that automatic or autonomic nervous system is divided into two parts. You have your parasympathetic, which you see on the left side of the screen. That's your rest and digest. That's the cool part of your nervous system. That's the part where you're having smooth digestion. You're breathing normally. Your blood vessels are functioning like they're supposed to be. In the sympathetic nervous system, that's the fight or flight. So that's the part where when it's prolonged and it's always being upregulated due to a stress, which in this case, we're talking about physical stress, it can result in issues. Some of the issues is increased heart rate. If this happens over time, chronically, that's how you get tachycardia. Your heart's beating fast all the time. That's how you get the nervousness, the anxiousness. Because that sympathetic nervous system is upregulated. Also, it reduces stomach and intestine motility. So you start having digestive issues. So your body's always in this defense stance, right? Because it's being upregulated. It's the cascade effect in a cycle that continues. Here's another example. You'll have a release of glucose into your bloodstream. So that's a lot of sugar in your bloodstream. If that happens for a chronic amount of time, guess what that results in? Diabetes. So there's an effect of this upregulation of the sympathetic nervous system, okay? And there are ways to downregulate it. And I will tell you that here shortly. So that's the first effect. Now, we're going to shift over to what's called the lymphatic system, because your nervous system controls your lymphatic system. If your nervous system is always in fight or flight, you always have this anxiousness, you're shallow breathing, you can't take deep breaths, you're always on edge, it will affect your lymphatic system. It will downregulate it. So it's an inverse relationship. So first question, what is the lymphatic system? This is a system of the body that's often ignored. Everybody knows you have the cardiovascular system, right? It's a circulatory system. Well, you also have another circulatory system, and that's your lymphatic system. On this picture, everywhere where you see these green lines, that's your lymphatic system. Those aren't blood vessels. But this lymphatic system works very closely with your cardiovascular system. This circulation goes from the lymphatic system to your blood system. Now, the purpose of the lymphatic system is to take things that don't belong or things that are in excess, like fluid, and dump it into your circulatory system. That way you can get rid of it, okay? An example, toxins. If you have toxins in your body, like you need to detox, right? Your body is supposed to naturally get rid of that. When it gets overloaded, that's when you have problems. Another example is if you have bacteria or a virus. Dare we say virus right now? The lymphatic system is the highway that's going to work with your immune system to flush that out of your body. If the lymphatic system is downregulated because of the nervous system, that sympathetic nervous system being high, that reduces your immune system, okay? Now, everywhere you see these little dots, those are called lymph nodes. So if you've known someone with breast cancer, a lot of these lymph nodes are affected, right under the armpit. That's the axillary region. Those lymph nodes are like checkpoints. Those are little filters. They filter out all these toxins. But here's the thing with the lymphatic system. The lymphatic system is not like the circulatory system that has the heart to increase flow of blood. The lymphatic system doesn't have that. It relies on something else in order to function and in order to have a flow. So some examples of your lymphatic system, okay? You have your thymus, which is very, very important in producing antibodies. It's important in producing white blood cells. You have bone marrow. That's important in producing white blood cells. Your tonsils are part of your immune and lymphatic system. So unfortunately, if you get those taken out, you're more prone to having bacteria or viruses get into this area and not getting fought off. You don't have that defense anymore. You have lymph nodes throughout your body. Your spleen is part of your lymphatic system, okay? Then you have a section in your small intestine that's part of your lymphatic and immune system. So isn't that cool? You have all these structures in here, all over your body. If this lymphatic system is not working correctly, the rest of your body is not going to work correctly, okay? It's going to impede your healing. It's going to impede your immune system. This is why in my clinic, we are starting to incorporate treatment of the lymphatic system and addressing it in order to increase your rate of healing. So the lymphatic system doesn't have a heart to pump, like I said before, but what it does have is called a muscle pump. So the lymphatic system relies on your muscles. It relies on movement. It relies on breathing, because the respiratory pump also helps to pump the lymphatic system. Also surrounding organs, the movement of the organs, the pulse from your blood vessels, all that squeezes against the lymphatic system to increase the flow. So if you're unable to move, the lymphatic system is not working well. If the lymphatic system is not working well, your sympathetic nervous system is going higher and higher and higher. That creates a cascade of disease, okay? Now, this is another thing that is also part of the secret of why it's important for you to keep your joints healthy. There are two main large vessels of the lymphatic system. One is called the right lymphatic duct. One is called the thoracic duct. So your right lymphatic duct is going to drain this dark green part of your body, okay? So it's going to take all the drainage from the lymph system from that side of the body. But just what you see in green. The rest of it is your thoracic duct, okay? So this thoracic duct is going to take a load from your lymphatic system. It has to be functioning properly as well. It has to have some kind of pump to get it to pump those toxins or things that don't belong in your body out. So I put this picture here so you can see the difference between the two. So I want to show you, okay, I did this morning for you. Okay, so I have this program that shows the lymphatic system. That's all the green. That big red structure in the middle is your diaphragm. Behind that, between your spine and the diaphragm, is your thoracic duct that drains a large part of your lymphatic system. So guess what? When you're breathing, you're help pumping that duct. So that duct is this big vessel right here in the middle. So what I did is I removed part of the spine so you can see that it's between your spine and your diaphragm. So guess what? If your diaphragm is bound up for whatever reason, if you're always in the fight or flight, you're not getting full respiration, you're not pumping that thoracic duct like you're supposed to. So that diaphragm is a muscle. It has to be trained. That muscle has to be, utilized. And as you can see, the diaphragm also attaches to your spine. So guess what? If you're not taking deep breaths and you're not able to because your diaphragm isn't functioning right, not only is it going to affect that duct, which is here, okay, it's also going to affect See how it attaches to your low back? So if you come in with low back issues, you have to look at the diaphragm. This is why I check the rib cage. This is why I check the diaphragm. If you're out of alignment, it's going to pull on this diaphragm and restrict it. Okay? So isn't it cool how your body is all connected? Okay? So all of this side of the body, on this left side, including all your limbs, are going to dump into this green large organ. Now I'm going to zoom in here. I'm going to highlight. Okay, that is your thoracic duct. It's also going to dump into what's called the cisterna chyli. That's that big structure there. Okay, and if that's not functioning properly, you're going to have issues. Okay, you're not going to heal properly. You're going to have, it's going to lend you to disease. All right, so I wanted you guys to see the visual for that. Okay, so I'm going to go back. And I'm going to show you, and all this started because we talked about joint dysfunction, right? So I'm going to show you how the diaphragm works.
The diaphragm is a thin, dome-shaped layer of muscle and tendon that separates the abdominal cavity from the chest cavity. It gains its shape from its attachments and from the organs that surround it, especially the heart, lungs, and liver. The diaphragm attaches at the costals along the lower rib cage, high in the front at the sternum, and deeply in the back along the spine. The diaphragm also attaches to itself via a central tendon.
So you see how it rises and falls, how that thoracic duct, which would be sitting right behind it, would be pumping. Okay, that's why it's good for you to move. It's good for you to exercise because it's going to activate that duct.
Making the diaphragm one of the unique muscles of the body. The diaphragm uses its central tendon and its attachments as leverage to flatten during inhalation. The expansion of the ribs comes from the resistance of the internal organs to downward movement. As the internal organs are slow to move, the ribs expand to make room for the lungs. While the diaphragm attaches at the bottom of the ribs, its range of motion never reaches that low in the body. As seen from below, we get a sense of the full range of motion of the diaphragm as it would glide over the aorta, the vena cava, the esophagus, and the internal organs. For more information, visit www.
Hey guys, Dr. Axe here. You know, one of the most common questions I get is, what is the...
Okay, so Dr. Axe can wait. All right, so I wanted you to see how that respiratory pump is so important. Okay, now you might ask, how do we down-regulate the sympathetics? How do we do that so that we upregulate our immune system and our lymphatic system? Well, guess what my answer is? You got it. Get adjusted. If your joints are functioning properly, then you're going to be able to decrease, that won't be a physical stress your body sees. And therefore, it does not have to go into fight or flight. And therefore, it does not have to decrease the immune system. And it does not have to decrease your lymphatic system. This is what I mean when I say getting adjusted helps your immune system. This is why I say it's very important because it helps to promote overall health. It affects your nervous system. So every time you get adjusted, it's going to down-regulate that sympathetic nervous system, okay? Now, another thing that we're implementing in our clinic is microcurrent point stimulation. That also uses a current to, yes, Tammy, I'm so glad. Thank you for watching too. But this helps to down-regulate your nervous system as well. And it's going to upregulate your lymphatic system. Okay, so I hope you guys get that. I hope I didn't beat a dead horse there. But I want you to see why it is so important, okay? Now, we can do a whole lecture on this topic, but if you can see the big picture, then it makes sense. This is empowering for you because now you understand why. I can tell you all day, hey, get adjusted. But if you don't understand why and you don't get the big picture, That's where the motivation to take care of yourself comes in. So this is secret number 2. The important secret to making sure that you take care of your joint health, you're going to improve your immune system. Okay, so this is a summary here. If you have decreased movement due to joint dysfunction, your body sees it as a physical stress. Once it does that, it goes into defense. Okay, you're going to upregulate the sympathetic nervous system. And because you're not moving, you're going to decrease your muscle pumps. You're going to decrease your respiratory pump. You won't be breathing fully like you're supposed to. You'll be in a shallow type of breathing pattern. And if you've ever been real anxious, you'll catch yourself and realize that you're not really breathing like you're supposed to be. Okay. Now, once this happens, now because the sympathetic nervous system is high, your lymphatic system is low. Okay, if your lymphatic system is low, it cannot help your immune system. Okay, so your lymphatic system is pretty much the highway to help your immune system to communicate across your body. Okay, if there's a block, guess what? Disease. Okay, and so that'll result in a decreased function of the immune system. So I really hope you guys enjoyed this. If you want to learn more about this, let me know, because I can break it down even more. And I want to offer to you, if you know someone, which would be everybody, by the way, they can always come to my office for a complimentary health discovery consultation. I do these on video. I also do these in person. And hold on, sorry. So yeah, I do these in person. I also do them virtually, right? I've always done that. And it's a time for you to find out if chiropractic is for you. And guess what it is? But and to make sure that we are a fit for each other. But I would love to help someone. And I love helping people, but I would love to help someone that you know they would benefit, because they're always complaining about hurting. They've tried everything and nothing will help. They're missing a piece of the puzzle, okay? So you guys can always contact me, 817-731-4848, or you can go to my website, saliensclinic.com, and I will be sure to contact you, and I would love to have a health discovery call with you. I hope you guys have a great day. Thank you so much.